Hi there, you're welcome to RX Care channel today. Thank you so much for checking us out for your medication needs today, and we would love for you to be a part of our community here at RX Care. In order to do that, make sure you hit that like and subscribe button down below, and also you can check out our free recipe to one of our diet plans here at RX Care by clicking on the link below, and it will direct you to how you can download that recipe for that diet plan that we do have on our website. Thank you so much for checking us out again, and please stay tuned. Hi there. So let's go ahead and talk about our medication of choice today. So our medication of choice today is known as Zetia. So Zetia is a medication that's also known as a generic name of Ezetimibe, and this medication is used for patients who have been diagnosed with high cholesterol as well as patients who have a heart disorder. So in terms of patients who are taking this medication, it is taken as a 10 milligram tablet once a day, and some of the side effects that patients do notice while taking this medication include diarrhea as well as joint pain. This medication can also cause back pain, muscle pain, or upper respiratory infection, as well as a sinus inflammation. All right, so what are some serious side effects to look out for while you're taking this medication? So you want to look out for any serious side effect pertaining most especially to your liver. So if you start noticing any signs of liver condition or abnormal conditions such as nausea, vomiting, that is very severe. If you start noticing any loss of appetite as well as yellow skin or yellow eyes or any form of abnormal stomach pain, you want to make sure that you're reaching out to your doctor. Also, if you start noticing any abnormal muscle tenderness or weakness or any muscle pain that just start happening all of a sudden, make sure that you're reaching out to your doctor so they can make sure that this is not a sign of muscle breakdown as a way of your body not being able to tolerate this medication appropriately. And also in patients, if you start noticing any abnormal swelling around your lip or your eye area, make sure that you're reporting that to your doctor as soon as possible. Also, for patients who are on this medication is contraindicated. Contraindication in terms of this medication should be avoided in patients who are also on a medication called a simvastatin. Using this medication in addition to simvastatin can increase the risk of that muscle breakdown, which is also known as rhabdomyolysis, and people would also refer to this term as rhabdo. This is a form of muscle breakdown that occur as a side effect of that medication. So like I said, make sure that if you're on simvastatin, this is not an appropriate medication for you to be on. Also, in patients who have an active liver condition, as I mentioned earlier, any loss of appetite, abnormal stomach pain, yellow skin, or if you've been diagnosed with an active liver disease, this is not an appropriate medication for you to be prescribed. Also, patients who are pregnant or patients who are breastfeeding, this would not be an appropriate medication for you. So let's talk about other things to look out for while you're taking this medication. So this medication can also be taken in addition to some other appropriate statin medication, with atorvastatin being an example of a medication that can be combined with Zetia in order to help lower the patient's cholesterol more effectively or improve their cholesterol level. Also, patients who are taking a medication called Welchol or cholestyramine, these patients want to take the Zetia at least 2 hours before or 4 hours after taking the Welchol or cholestyramine. So like I said, a major side effect of this medication that you definitely want to reach out to your doctor immediately when you start noticing is an abnormal sudden muscle pain. So you want to make sure that you're reaching out to your doctor if you start noticing that, as this may be a sign of rhabdomyolysis, and they will have to run some blood work to make sure that there's no form of a muscle breakdown that's been occurring because your body is not able to tolerate this medication well. All right, so I hope I was able to let you in on what to take or what to look out for while you're on this medication. This medication is very effective in lowering blood cholesterol, and it's I've seen some huge difference in patients' labs compared to before and after they start this medication. So it's definitely worth the try. So make sure you let us know how you're feeling with this medication. Be sure to leave any comments down below. Also, if you haven't yet done so, make sure you hit the subscribe button down below. That way you're able to join our community here at DemiRx Care and support our community here at DemiRx Care. Thank you for watching and stay tuned.